Hello, and welcome to the Waldenstrom's Macroglobulinemia Patient Perspective video series. I am Sharon Piotrowski, and I will be your host. The information you will hear in this video series is from the perspective of WM patients and/or their caregivers. The goal is to share their unique perspectives, which may help someone else who has been diagnosed with this rare cancer. Please remember the information provided by the participants in this series is reflective of their unique journey. It should not replace the advice you are getting from your own doctor. This week, we'll be hearing from 5 WM patients discussing how they found out they had WM. Thank you to all who are participating for sharing your journeys. Let's get started. Thank you for joining me today for the WM Patient Perspective video series. Today, our guest is Margaret, who's going to share her journey to finding out she had this rare cancer. Welcome, Margaret.
Thank you, Sharon. It's so nice of you to do this for the patients. I'm thrilled.
Well, I'm thrilled to have you. And let's just get right into it. When were you diagnosed? What month and year?
January of 2017.
Wow, so not that long ago.
Mhm.
Can you share with us briefly, because we're going to have lots of questions, how did your journey start?
Well, I had an underlying autoimmune disease, which I thought was the sum total of my problems. It's called myasthenia gravis, one of the many autoimmune diseases that we seem to have. And it is progressive, and I just got sicker and sicker and sicker. And finally, I staggered into an ER and said, whatever's wrong with me, they're not finding it. And I can't sit up or stand up. I need help. And they drew my blood and said, "Oh my gosh, your hemoglobin is 4. We're not 100% sure why you're motoring around." And their comment was, "You don't get to 4 and function unless you got there very, very slowly."
Do you, looking back at that point, now knowing where you're at today, do you realize that you had issues before you, I mean, obviously you felt sick enough that you had to go, but even before that point, were you feeling certain things?
Oh my goodness. And I put it all in the wrong bucket. I put it all in the autoimmune disease bucket, but you know, out of breath, progressive anemia, um, extreme fatigue, brain fog. All my lymph nodes were swollen all the time. I caught every sickness that came around. I had joint pain, muscle pain, whole body neuropathy, like,
Hmm.
just constant. But the really debilitating thing was that any use of strength would cost me a couple days to get over it. So I had to really budget my energy, and that recipe, if you will, got worse and worse and worse, literally over 20 years until I was pretty much bedridden. And
So for 20 years, I'm going to assume off and on that it progressively got worse.
it did. My son was born in 1998, and I had had some symptoms before that. But when I got pregnant and delivered a child, it just went wild. And I thought it was the myasthenia gravis, but and it's hard to sort out what was what because I didn't know there were two things brewing. And so to me, it was just one event, the symptoms that I felt. But as the WM progressed and became really probably more significant than the other, I'm beginning to be able to be separate out the two diseases and know what's causing what. So I think that the major culprit was a very long course of Waldenstrom's prior to diagnosis.
Can you explain what your other symptom, your other illness is, just so we can compare what the two is, and if there is a comparison or similar?
Absolutely. So all those autoimmune diseases are a matter of geography. Like if you have rheumatoid arthritis, your immune system is picking on your joints. If you have uh, lupus, it's picking on your connective tissue. In my case, I had myasthenia gravis, which meant my immune system was attacking all the muscles in my body.
Hmm.
So my immune system would take my muscular strength away progressively. Very challenging.
That sounds challenging, and that must have been scary. I assume, too.
It was scary because my father has it, and, he's gone now, but he was quite ill. Men have a later onset and a more severe disease course, I think, for that. So watching him, I was like, "Oh my gosh, that's gonna be me." So that it was terrifying.
So let's, and my heart goes out to you to have two different things
Yeah.
going on. Let's bring you back to the diagnosis. So you mentioned that your hemoglobin was 4. Do you remember what the range is? Like what made them concerned about that?
I do. Normal is, I think, 12 to 15, and women, I think because we have menstrual cycles, we tend to ride at the lower end of the normal range. So anything north of 10, they're like, yeah. So mine was going 12, 11, 10, 9, and I had a primary care physician who was asleep at the switch,
Mm,
and did not, because I had been so sick for so long, we all just lumped everything in that one bucket. Well, anemia is not part of an autoimmune muscle weakness disease, but she just saw me as a chronically ill person.
mhm,
And as my primary care, I thought the world of her.
mm.
And if she said, I'm going to roll over on these abnormal labs, I said, okay, because I was sick of being sick. I didn't need a new sick.
So now you've a suspicion is there that something else is going on. What was the next step? Did you end up going to an oncologist? Did you have scans, more blood work, all that kind of?
So I'm not the only person to have had this experience, but because I thought it was the other disease, I waited many months to get in with a very fine myasthenia gravis neurologist. And I lost it in his office, just bawling. I said, please, can you help me? Of course, I didn't know at the time my hemoglobin was in the single digits, the lower ones. And I'm bawling. And he took one look at me and he said, there's nothing wrong with you that a good psychiatrist couldn't fix. There's nothing wrong with you. I think you are doing all of this for attention. And he lambasted me in front of a resident and a medical student. I'm not the only person to have had this experience. But because I was so ill, it absolutely decimated me. And I left his office. I don't even remember driving home. And 3 days later, I was like, okay, nobody's going to help me. I'm dying. So I'm going to the ER now. Screw it. And I just stayed out of the emergency room because myasthenia gravis, a lot like Waldenstrom's, is a rare disease that can walk and talk like other things. And it's not something they see in the ER very often. And so I just had never gone that route. I refused to go that route. And that was stupid because the medical providers I was holding on to were not adding up things correctly.
What was the turning point then?
So I was at my cousin's and I realized that I was negotiating with myself
Mm,
about whether or not I could get up and walk to the bathroom. And I was laying on the couch going, all right, 5, 4. It was like, I don't know why I made this kind of a, I don't know why I let myself get so far down just because I guess I was hopeless about being helped.
mm.
And so I made it to the bathroom, hanging onto the door and and then I was so out of breath. I stayed in the bathroom a good long time. I think my heart rate was 140, 150, and I walked all of about 20 steps.
Mm.
And I was like, okay, all right. I was terrified because in the olden days, the people who used to die of my other disease, uh, God, I can't even, MGWM, myasthenia gravis, your diaphragm would be one of the muscles that your body would disable. And I was like, they're going to put me on a freaking ventilator when I'm conscious. I'm not doing it. And so I just refused to go to the hospital
Okay.
until I thought, okay, I can't stay conscious if I'm not lying down. So I have to go for help. And like a dummy, I drove myself. And I was in such a marginalized state of consciousness, I couldn't find the hospital. I was right in front of it and I kept going around it. And finally, I just pulled over and bawled, my usual form of help me communication, and said to someone, I need to find the ER and I can't find the ER. And he said, follow me, honey. God bless that man. And
Mm,
I just stayed on his tail and he took me to the ER. And I certainly didn't look sick. I never looked sick. And when I sat in the ER after about an hour, I had to raise my hand to get the triage nurse because I could not walk up to her desk. And I said, I'm going to fall over and
Mhm.
I'm going to black out and I need some help. I'm getting choked up just having to relive that. And
Let you have a break because I was
thank
getting
you.
shook up with your story too. I just now that we know that you went to the ER and obviously they figured out something was wrong. How did you find your oncologist and where did you go with your oncologist at that point? And were your symptoms really, I mean, it sounds like they're really pretty bad at that point. So when you got to tell me at the point of the oncologist part.
All right. So because I went to a hospital system that has a great teaching network and doctors in many disciplines, right there, they had a hemonc come down to the ER and talk to me. And they said, we think you have some kind of cancer. And so they planned a bone marrow biopsy for me. And um, I'm one of the folks that had a really unpleasant experience with a bone marrow biopsy. It was these medical students, and they were using a hammer and a trocar and no anesthesia. And when you're on a bed, the bed's not a hard surface. And so I had a very suboptimal and traumatic bone marrow biopsy, and they could not seem to get any juice out. And I found out later that I had so much um, fiber or scar tissue in my bone marrow from having had Waldenstrom's for so long undiagnosed that they had a hard time doing a decent bone marrow biopsy. They got an inconclusive sample, and I got an incorrect diagnosis of myelodysplastic syndrome. So, meaning your bone marrow is just not doing a good job. It's not making blood cells, and we don't know why. It's just a syndrome. And so that meant that I was going to live on transfusion. And myelodysplastic syndrome is a worse diagnosis than Waldenstrom's, which now I realize that. But it meant I had a severely limited lifespan and I was going to be living on transfusions for the rest of my life. I had 26 transfusions
Oh,
and got to the point where I was like, I don't want to do this. I don't want to do this anymore. They transfuse you from 6 back up to 8.
mm,
And living between the 6s and the 8s is not a good place to be. You have no peripheral vision.
mm.
Your body goes into all sorts of adjustments. And I got to where I could not drive to this hospital for transfusions. And I went to a local hospital and they said, we don't think you have been correctly diagnosed.
Let me ask you a question. So those transfusions were maybe not necessary because you weren't being diagnosed with the right cancer or the right issue?
They were necessary because I was diagnosed as having myelodysplastic syndrome, that my bone marrow had failed for unknown reasons and there really was no treatment. And so it was incorrectly diagnosed.
Did you have to have another bone marrow biopsy done in order to diagnose the WM?
Yes. So after 6 months, I had another local oncologist and I said that I'm still getting sicker. I think that this is not correct. My sister, God bless her, who lives in New York, thinks everything in New York is better. And in this case, she was 100% correct. She said, I'm coming to get you.
Aw. So I
She
gather you
did.
went for another bone marrow. And do you remember what the percentage of involvement was at that point? And at
It
any
was,
point, did you find out your IgM level?
I do remember my IgM was only 1500
Mhm.
and my percentage of bone marrow involvement was 30%, both of which are nothing compared to many people. Um, but that was a critical level for me.
So let me take you. So I gather after all that, and finally you have the diagnosis. How did you feel at that point? Now you're diagnosed with a rare cancer that's not curable, somewhat treatable for most people. How did you feel at that point when you finally, was it a sense of relief because now you had something to hold your hat on to a certain, and then obviously other issues. So let me know how you felt at that point.
Exactly, Sharon, exactly. Just knowing, okay, it's not my imagination. I'm not a psych patient. It's not the myasthenia gravis. And it's not, oh, shucks, we don't know what happened to your bone marrow. It's this is what happened to your bone marrow and it's treatable. I was like, I was so happy to be able to be treated. But like lots of others in our community, by then I had been, what's the word I'm looking for? Invalidated by enough physicians, and I was completely physically debilitated, had to roll around in a wheelchair. I was like, I can't do this. I can't do this. Because when people say cancer and they say treatment, the most severe mental pictures of what that means are what you assume your reality is. And I was like, I am not up for another fight. I'm out of here. I just, I'm just going to let this take me out. I'm just not going to do it. And I was in that place for just a couple days, and I spoke to a number of cancer survivors in my circle, and they were like, Margaret, that's the cancer talking. We know you. You would never give up. You have a son. He hasn't gotten married yet. He hasn't graduated college yet. You just put one foot in front of the other. You don't know what you're biting off. And so I think I went into treatment with a bad case of self pity.
Well, let me ask you, try
And
to wrap this up a little, because your story has been, I think, going to help so many people, because there's so many different stories out there. Looking back, advice to someone else that's coming up here, just looking back, and I think I know kind of your answer. What is it that one or two sentences? What is your advice to somebody else learning that they have this or having symptoms leading up to this?
my advice is don't be afraid. The treatment is not the worst case scenario that you manage in your head. It put me in complete remission. I am in the normal IgM range. My hemoglobin is 15, and I am back to work for the first time in 20 years, and you can do it too.
And you look fabulous, by the way. I would have
Thank
never thought.
you.
Though you mentioned something. Well, you're welcome. And you mentioned that some people would say, "Well, you don't look sick." I've always heard that. Like people go, "You just don't look sick." So I think cancer comes in different, phases, but you look differently. But Margaret, your story very important, and thank you so much for sharing this with us today, because I think it's going to help a lot of people. Thank you so much.
Thank you, Sharon.
Thank you again to Margaret. And on behalf of Margaret, the IWMF, and myself, we want to thank each and every one of you for coming out and listening to Margaret's story. She really, I think, presented a lot, and it was very heartfelt. If you would like to participate in future topics, please email me at wmpatientperspectivevideos@gmail.com. We would love to have you. Also, we'd love your feedback, so please leave a comment in the comment section below the video. Again, thanks to everyone out there watching, especially Margaret, for joining us today, and I'll see you on the next video.